Essentially what LifeMasters does and disease management companies try to do is really reduce that gap between the evidence-based practices and what people actually do. We're trying to address that gap in care. And that's typically done telephonically through partnering a person with a chronic illness to work with a nurse or a healthcare professional. Now switching to the MVTs and how we applied them in our organization, we're having difficulty enrolling people in our programs, enrolling them and engaging them in our programs. And by enrollment, I mean simply agreeing to participate in the program, to work with the nurse over an extended period of time. And by engagement, I mean sustained participation, not just saying yes, but showing up and working with the nurse on a regular interval. And we needed a quick solution because obviously our program is predicated on having enough people in there and working with them to make an impact on the cost. You need scale for this program to work. And so we had members on our team that had used MVT beyond myself in previous settings, and at the time we were using a lot of different techniques to try and a lot of different tactics to try to get people enrolled and engaged in our programs. And we knew from our QualPro experience that 70% of the ideas are not going to help. We had attempted unsuccessfully to enroll 6,640 participants over a 2.5-year period. And in that 2.5 years, we had made in excess of 57,000 contacts to try to get them in the program. So from a QualPro perspective, their 12-step process, it kind of looked like this. We chose our high payoff goal, which was to enrollment engagement, and we chose the measurement of success, which was increases in enrollment and engagement. We held brainstorming. We involved all levels of the organization, both in the field and in our centers. And our initial brainstorm list was about 200 ideas. We narrowed that list down to 28 ideas, and we launched the MVT in March and completed it in May. From March 11th to July 8th, we enrolled over 1,000 people from that 6,640. So we had a 32.5% net improvement in terms of total number of people participating in the program. So we had very, very good success. So 2.5 years, 57,000 contacts. We weren't able to put people in the program. In a little over 3 months, we put 1,000 people in. So we had very, very good results from the MVT.
Really what the MVT is all about is making sure that the interventions we use are not only evidence-based in literature, but evidence-based in terms of our outcomes. So we invited QualPro to the table to really take a look at how we could go back and maximize our approach to.
Our goal is to really reduce unnecessary or avoidable acute utilization. So that's obviously one of our key measures. We're also looking at the cost that's involved, both on the outpatient, inpatient, physician, and pharmacy basis. And people have been extremely engaged, extremely excited about this process, and I think that speaks to the power of MVT.
We already have seen between a 10 and 15% reduction in our admissions within our population.
QualPro is not an expert in what we do. They're not an expert in disease management, population health, clinical programs, getting people into them. However, they are experts in scientific testing. And so we have all kinds of people who think they're experts in what we do. And many truly are. And many we're paying to give us even more advice. And so being able to utilize QualPro as not an expert in our field, but an expert in scientific testing of our processes and what we do is very, very powerful.